the cost of Obamacare. That's what we'll talk about today. A lot's been published about the overall cost of Obamacare, how many trillions of dollars and stuff. But now the cost for an individual family is beginning to become clear. And in California, one of the first states to set it up, they have published a list of the costs that will be associated with Obamacare. So let's describe the costs for an average family for the silver plan. There's a bronze, silver, gold, and platinum. I guess they got that from frequent flyer programs. And this would be the silver plan, which would not be the best or the second best, but would not be the worst. It would be kind of in the middle. Now, in listening to this, just understand we're talking about a family that makes $50,000 a year, the median household income, or an individual wage earner who makes $40,000 a year, the median wage in the United States. So put your mind into that concept and listen to these numbers. The policy itself will cost $335 per person per month, so about $4,000 a year. So a family of four would be $16,000 to cover. An individual worker would be $40,000, 10% of his pre-tax income. The copay you'd have to pay if you visit a primary care doctor would be $45 per visit. For a specialist, $65 per visit. And each time you get a generic, not a brand name, but a generic prescription, $25 is a copay for each refill as well. The deductible over the course of a year would be up to $2,000, 5% of their pre-tax income. And the total out-of-pocket expenses by any recipient is capped at $6,500 over the course of the year. Just absolutely incredible, astronomical figures. Now, when people begin to understand the extent of this cost, for people who, for the most part, don't want insurance, don't have insurance, and in most cases don't need that level of insurance, it's going to be absolutely incredible. And the backlash, I think, is going to be huge. Most people will simply elect to pay the fine, in which case they're paying initially $200 a year, and then in a year or two, $700 a year for absolutely nothing, as punishment for not buying a health insurance policy. We can only speculate on what the political impact of this is going to be when it becomes clear to people that what this program is going to cost them, not the taxpayer, not somebody else, but them. And I think that the numbers in California indicate that it really will be horrific. On a related subject, there is a study that was just done that confirms what we've been saying all along, that there is a tremendous and looming shortage of primary care physicians in the United States. George Washington University did a study that found that only 25% of medical school graduates become primary care physicians. And you have to be a primary care physician to then move into a specialty like oncology or cardiology or that sort of thing. 75% either don't practice or go into fields like radiology, pathology, dermatology, psychiatry, that are not considered outgrowths of primary care medicine. And of those that go into primary care medicine, only 4%, 5%, 4.8%, end up in rural, underserved areas. And the problem is, with any other government benefit, money suffices. You want to build up the military, spend a lot of money. You want to increase medical research, fund it. But with medical care, you can't do that because you need doctors. It's not enough just to pay. You need people who actually have the skill and the ability and the experience to minister to patients. And if you don't have doctors, you're not going to have medical care. And with the cuts in reimbursement rates and the bureaucratic hoops that doctors have to jump through under our new system, you're going to have fewer and fewer doctors, and more medicine will be done by nurse practitioners or by physician's assistants, which is definitely not the same thing. So Obamacare will cost too much for the individual, and even after they pay it, they're not likely to get quality medical care. Thanks for watching.